Dr. Kahng, let's talk about wisdom teeth. Personally, I would like to know why the hell they call them wisdom teeth. Are you really wiser when you have them? And if that is so, why are you taking them out all the time? What's the deal about wisdom teeth? What I really want to know here is, all joking aside, is there's so much drama about putting out a wisdom teeth, which apparently has to come out. I would like to tell you to tell me why most of them they have to come out. But what's the drama behind? Why is it such a complicated thing and so painful apparently? Or is it really not so painful anymore and that's just a misconception from the old days when it maybe was painful, when surgery wasn't as advanced as it now is? Tell us about it.
Okay. Wisdom tooth is the last tooth in the mouth and it's hard to reach there. So people, when they brush their teeth, it's hard to brush on that area, so it causes some cavities. Not only that, the location of the wisdom tooth is the corner in the back, and many times it doesn't come out straight. Sometimes it can crook in the inside or outside, or even sometimes it come out backward, and then it causes all kind of problems. Can cause the pain, or can cause a gum disease. Even it can cause some kind of a TMJ problem because it can push the front teeth. So usually when the wisdom teeth doesn't come out straight, then we recommend to remove that so it can prevent future serious problem.
If it doesn't come out straight?
That's right.
Okay, I see. Okay. And what's an impacted wisdom tooth like? That's one who is totally crooked?
Impacted wisdom tooth is impacted. The word impacted means the tooth is underneath the tissue or underneath the bone. So when it's underneath the bone or underneath the tissue, well, sometimes it come out just halfway. We call this partially impacted. Those are caused so much infection because you cannot brush properly. Also, it's not fully erupted, so it's partially erupted. So food stopped under there and cause lots of pain or swelling and infection. So we highly recommend to remove those infected wisdom teeth.
Right. Now, and you recommend to get rid of them as fast as possible around 18, 20, 22, whenever they appear, rather than at a later age, simply because it's easier to do an operation when you're young, or what?
Younger age is easier to remove them. With get old, the bone getting too hard, or there are other complications that can involve. So younger age is better to remove them.
Mm-hmm. Now, so the other question I had here, why, the operation in itself, is it such a more traumatic operation? And if it is, has it nevertheless gone better in the last few years, or a decade or two, whatever? Has putting a wisdom tooth become less traumatic than it used to be due to advancement in dental care?
Extraction for the wisdom tooth, the technique is pretty much very improved now, and not that much trauma on the tissue, it can be removed. So extraction of the wisdom tooth is not a typical procedure. So you can go to your dentist and it can be removed.
Right. So it's not so painful.
Not really, because you can take the medication you can have the extraction on the sleeve, and after extraction you can take some pain medicine, antibiotics. So pain is not that much a problem.
Can a person, on an average, go back to work, school, next day, the same day?
Mostly the next day should be alright.
I see. So the same day he's probably heavy under anesthesia and a little bit drugged, right?
Same day usually we recommend the patient rest. But the next day, most cases there's not much problem.
But on an average, or all the time, he or she still has to take medications for a few more days, yes or no?
Usually we recommend some medication for 1 or 2 weeks for the prevent the infection. Yes.
Mainly for the infection, not for the pain.
Not for the pain, for the infection. Possibility of the infection, we try to prevent. We suggest take some antibiotics. Pain medicine just for a few days usually.
Okay, got it. Okay, wonderful. Thank you very much again.
Thank you very much. Thank you.